Welcome to another episode of the EADV Podcast. In this edition, Dr. Sweta Rai speaks with Professor Severin Läuchli, a leading dermatologic surgeon and president of the European Society of Mohs Surgery. Together, they explore the evolving landscape of Mohs surgery in Europe, from historic techniques and training challenges to new standards and growing interest from young surgeons. But before we begin,
unlock your professional potential within an EADV membership. Join a global community of dermatologists and venereologists and gain access to exclusive benefits, resources, and opportunities to grow in your field. Become a member today and be part of the Academy. Learn more at eadv.org.
Stay tuned to learn how Mohs surgery training is expanding across Europe, what's needed to support its future, and why collaboration between clinicians, institutions and societies is essential to making high-quality skin cancer surgery more accessible.
Good morning. Good morning and welcome to the EADV podcast. With me today, I have Professor Severin Läuchli. He is a dermatological surgeon and Mohs surgeon in Zurich, and he is one of the pioneers of Mohs surgery and Mohs technique in Switzerland, and also is the head and lead of the European Society of Mohs Surgery. And I wanted to wish you a warm welcome on the EADV podcast, we're going to be having a discussion about European Mohs surgery training, which I've been asked by many residents who have come to visit me here in London about training and training standards within Europe. So we're going to be focusing our discussion on that, but also on Professor Läuchli's training journey itself, and also any tips and pearls he may have for any junior dermatological surgeons looking for a career in Mohs surgery. So welcome, Severin.
Good morning, Sweta. Pleasure to talk to you this morning.
Thank you. So, Severin, this podcast was inspired by some students who came and visited and wanted to learn about Mohs surgery within Europe, and you have trained within Europe, and I wondered if you would share your training journey and how it all started for you.
Yes, so I was trained as a regular dermatologist in Zurich, Switzerland, at the University of Zurich. And after I completed my residency, I started to develop more and more interest in dermatologic surgery. And I was very lucky that I was able to have a prolonged rotation during my residency already in dermatologic surgery. And I was able to continue that as a staff physician. Now, at that time, there were no formal fellowships for dermatologic surgery, or let alone Mohs surgery in Switzerland. So how it happened was that, of course, we did dermatologic surgery before in Switzerland also, and skin tumors were usually excised with the slow Mohs technique, or we actually prefer to call it micrographic surgery, which includes various techniques. And so I was very lucky to be trained in that. So we excised tumors, we embedded them in paraffin, in formalin. We made paraffin sections, and 2 or 3 days later, we got the results from our dermatopathologists, and then we would close the defects of these wounds that we had created. And this was a principle that worked very well, but of course, I had heard also of how it's done in many other parts of the world, especially in the US, where Mohs surgery is really the standard of care for especially the infiltrative and more difficult epithelial tumors. So I went to the US and visited several centers. Actually, I pieced that together a little bit for myself. I wrote to a few people who were well known in the field. Hey, can I come and observe? Can I do a short training period with you? And I also attended a course which was organized in the US on Mohs surgery. So I learned about the principles of Mohs surgery in the US, and I had the really great chance to observe many different, very good Mohs surgeons in the US and learn the technique. So in short, I think I learned the surgery in Zurich, but I learned the Mohs technique. What is special about Mohs, I learned by visiting different people. And it was largely self-organized because we did not have any fellowships, any formal training programs available for this.
Yes, no, absolutely. And that's why I thought it would be important for people to hear how it was previously done. And also, just to clarify on the Mohs technique, you mean frozen section, same-day Mohs technique is what you went and learned in the States so that you could make the Mohs surgery technique more seamless and done on the same day. Is that correct?
That's right. So we did the micrographic surgery in several days, but what was really new and what I was able then to start in Zurich with great success was the frozen section technique, which I am a great believer in because it really is much more comfortable for the patient to have his tumor removed and the defect reconstructed in one day. And I also believe there are certain advantages in terms of precision with the frozen section Mohs technique, where the derm surgeon himself or herself really looks at the slides. And I think it makes a big difference if you see what you excised yourself. It gives you a much clearer picture, a much more precise picture of what you're doing.
Absolutely, totally agree. And just so that other people are aware of other techniques within Europe, before frozen section became mainstream, and even till to date, that you've done an amazing publication on the position statement of the European Standard of Mohs Surgery, where a lot of the board members of the European Society of Mohs Surgery were involved. And reading through this document, which I recommend people listening to this podcast reading through, is that you have really described well the different types of techniques and how Mohs surgery evolved in Europe, the historical perspective. I found that very interesting. And could you tell us a little bit more about the different techniques that are around in Europe for other people listening?
Mm-hmm. So, yes, and there were other techniques around and still are in many parts of Europe. The only type of micrographic surgery available is micrographic surgery involving paraffin-section. And I think the most commonly used is the one that's called Tübingen-Torte, because it was described by the team in Tübingen in Germany. And this involves excising the tumor, and then the surgeon actually cuts a thin strip from the margin of the tumor and also from the base of what you excise. And you put this in different cassettes to make paraffin-section. And then usually this is read by a dermatopathologist the next day. And so you get a report from the dermatologist. There is like a remaining tumor at 3 o'clock or whatever. And then you do the second stage of the excision and send it again for a paraffin section. This is a good method because it's very precise, it's very reliable, it's very safe to really detect remaining tumors. You usually have very good quality slides within an existing infrastructure, which most dermatology departments would have. And so it makes sense from an oncological perspective. But as I mentioned before, it has disadvantages also. You have to leave the wound open for 2 or 3 days. And there is some loss of precision because the surgeon herself or himself usually doesn't see the slides. So there are pros and cons for these different techniques.
Yeah.
There are other techniques. There is the muffin technique. There is the Munich method, which just involves horizontal sections. So in the Munich method, the whole specimen is just cut horizontally. And there the surgeon usually looks at the slides, but this creates a lot of slides to look at, and very strictly speaking, is not 100% margin control, because you could have gaps in the horizontal sections. But these are all methods that have been used in Europe for many years, and in many countries still are the only way of micrographic surgery available.
Absolutely. And mainstream being the frozen section same day technique, which is the standard most micrographic surgery technique, where horizontal sections are given and we have high cure rates with. Thank you for going through that. Now, when you came back from all this training that you had done and you set up your Mohs service within Zurich, because there are many people who contacted both you, I'm sure, and they contact me too about how to set up a service. And I'm very lucky that I came to a set of service that was already set up by a colleague of mine, and those challenges that you face as a new Mohs surgeon. Can you give us some insight into that, and what was the most intricate part of it? And any tips for any future derm surgeons who are looking to set up their service?
So actually, it's a huge effort to do this if there is no existing structure for this, but it's possible. And I have to say, in retrospect, it was greeted quite well. It was welcomed in Zurich, where I was able to set this up. All my colleagues were very positive about doing this. So the main effort was really to set up the lab infrastructure, to establish the frozen sections, and to train technicians. We fortunately had some lab technicians that were well trained in performing frozen sections, but they were not trained in performing the specific Mohs sections, where you have to flatten the specimen, where you have to make sure that the entire epidermis is visible on the specimens, and all of these things. So I was lucky to also be able to learn that in the US, and to really train our lab technicians for this also. And then we just did it. I think the larger resistance maybe came from other areas in medicine, like plastic surgeons or ENT surgeons, who were very skeptical if this Mohs frozen section was really reliable. And I think that took a lot of convincing and showing them that there is good literature, there is a very good agreement in the scientific community that Mohs micrographic surgery with frozen sections is the standard of care for these epithelial tumors. And I think by now, so it was a long and difficult journey, but by now I can say in Switzerland we are at the point where Mohs surgery is very well accepted within dermatology, and largely also by the other medical specialties. But it took an effort. It took also a lot of going around and talking to people, giving lectures at conferences of plastic surgeons and explaining to them. So it was a slow process, but I would say quite successfully so.
And definitely worth it, I think, because it creates a multidisciplinary advantage to our patients, which if we go out and speak to people about the craft and how it's done, and get people on board and collaborate with people, that is a way of breaking down barriers, which you have demonstrated and shown. And so for anyone new who is in Europe setting up their first service in their country, which many people are in the position of today, it seems quite foreign to you and I, who are used to having a Mohs service. But when I hear these stories of people being the only Mohs surgeon in their country, etc., it is possible that by befriending other specialties, you are able to break down those barriers and create a service and create a successful service, which patients are very grateful for. At least I can say in London, most patients are very grateful for having their tumors removed precisely, smaller holes, smaller defects, better scars, dare I say it, but all of those things which come with the Mohs technique. Now that's fascinating. And on the lab point of view, if somebody you obviously went and trained in the lab technique. How long did that take you for someone who is entering this for the first time? How long did it take you to understand how the processing worked and train someone up to a proficient standard?
Well, I think that's an important point, because as doctors, we are not very interested in the lab process, and we don't really care with it. It's somebody else's business. But when you do Mohs surgery, and especially when you start a new Mohs service, I think it's very important that the doctor is also able to perform the sections and also to guide the technicians. And I mean, I cannot say how long exactly, but it took me several weeks to really, every day when I was doing Mohs, I also spent some time in the lab observing the experienced technicians and really understanding what they were doing exactly. Now, of course, in the meantime, we do have a little bit a larger Mohs community in Europe, I would say, and also the lab technicians are a little bit better organized. The ESMS has a section for lab technicians, organizes courses for lab technicians. There are some experienced Mohs technicians in Europe who can be consulted. So I think things have become somewhat easier, but it's still not as much mainstream as I would like it to see in Europe.
Absolutely. And so just jumping onto that, because where you'd like it to see, I definitely remember as part of my fellowship, I went to Yale, which has a very prestigious dermatological center, surgery center run by Professor David Leffel. And I remember that we all rotated through the histotech lab and were shown how to cut our own specimens. And we were by far not as good as the technicians, but it gave us insight into the problems that the technicians face, etc. And so for your vision as the leader of the ESMS, where people from all over Europe come to you, where do you see European Mohs surgery going in the future? And what would you like to see in terms of training for future dermatological surgeons?
You mentioned a very important point there. I think training is the key. And there, unfortunately, I have to say we're still in very early stages in Europe. We have many centers, many countries where Mohs surgery is quite commonly practiced. I think especially the Netherlands have a very good level of Mohs surgery. I think Switzerland, there is also quite a few. There are many in Spain, in Portugal, and in some other countries spread around. But there are no, or almost no, let me rephrase that, very few formal training opportunities for Mohs surgery in Europe. And that's something where I definitely would like to see an increase. There are possibilities to train in Mohs surgery in Europe. The EADV offers 4 or 5 fellowship positions every year now, which can be applied to through the EADV. And this allows the applicants to spend 6 months in a busy Mohs center where they really should be able to see a high volume of cases and operate a high volume of cases themselves also, and fulfill the criteria to become an ESMS certified Mohs surgeon. Other than that, a lot of it is still self-organized. So through contacts with established dermatologic surgeons that would allow an extended visit or an observership, this can be a starting point also. And the ESMS also supports this. If somebody would like to just get a first idea, if he or she can do this, you can get in contact with a Mohs surgeon and and apply to the ESMS for a funding of such a visit, which is more just to get an impression. But it's a start, and you have to start somewhere.
Absolutely, absolutely. And that's what's kind of instigated this podcast, because we've accepted a few where I work, and I'm sure you do as well, who are coming from over Europe and understanding the techniques of Mohs. And even understanding the technique helps you, even if you don't become a Mohs surgeon afterwards, it helps you understand what you're referring for and what service patients are going to get when they arrive at a Mohs center. So that's really helpful for for European aspiring Mohs surgeons to have this facility available within the ESMS. Now, going back to your standards, though, for Mohs surgery to be a certified Mohs surgeon within Europe, how many cases would you have to do supervised and independently to be accepted as a certified Mohs surgeon?
So in Europe, we have somewhat slightly more flexible standards than, for example, in the US, where you have to be fellowship trained, you have to have a very high volume of cases. We try to make it a bit more accessible, but still maintain a good and serious level. So in Europe, for being an ESMS certified Mohs surgeon, you have to operate 100 cases independently under supervision of a certified Mohs surgeon. You have to show that you have certain conditions for the infrastructure, like proper operating theaters, etc. And of course also the proper equipment for doing the frozen sections. So these are the standards to be certified in Europe. If you fulfill these standards, you can apply to the ESMS, and the board will review your application and accept you as a Mohs surgeon. Now, of course, the question is, what do you do if you don't have the opportunity to train with someone and operate these 100 cases? That's really a problem. Then I think you have to be creative to get in touch with someone to be able to be trained. For those who started, like I started 20 or 30 years ago, and really have to puzzle it together themselves, but have since operated high volumes in a good fashion, there is also the option to request an audit. So the an ESMS board member will visit your center and see if you really perform Mohs surgery up to the standards that we set, and can also do a certification by this way if you don't have the opportunity to operate these 100 cases under supervision.
Okay, fantastic. So you could set up your own center and have somebody visit you after you had completed 100 or whilst you're completing?
That's right, yes.
Okay, all right. Well, that's very, very helpful. And where are the centers at the moment where people could apply for within Europe?
So at the moment, there are, as I mentioned, 5 centers actually that offer these Mohs fellowships. It's in Valencia, in Paris, in Rotterdam, in Bucharest, and in Zurich. We are one of the centers, which I think are all centers that offer a good education. But of course, it's not enough. I realize that the demand in Europe would be much higher than that. So we are really trying to motivate other centers also to offer fellowships, to offer training opportunities. But this is also a long process to get the universities and the hospitals to do this.
Absolutely right. Absolutely right. Especially with the skin cancer cases increasing and the volume of personnel doing it not being up to par. It's really important that people do maintain their interest. Now, as we try to wind down in the podcast, where I wanted to really ask about your own vision for where the established centers, for example, within Europe, not the beginning centers, I guess. Where do you see the future of Mohs surgery within Europe going in terms of, have you read any great publications about some interesting arenas to explore within Mohs? There's a lot of talk about artificial intelligence in skin surgery and in Mohs. And what is your vision? And where would you be, interested to maybe consider research in? If the ESMS was funding some research opportunities, where would you see that research going?
So I think there are many exciting prospects for the future that we will probably see within the next few years. And you mentioned a couple of them already. I think there are many imaging techniques which maybe at some point will be able to provide as a margin control for tumors as well. Mohs surgery does. I think we are not quite there yet. We have good data with many of these imaging systems like confocal microscopy, rapid lump examination, things like that. So we have good results, but they are partially for technical reasons, costs, but also experience with the systems. So we're not there yet that they can be used in everyday practice, but many centers already do use them in parallel to performing Mohs surgery. And this is certainly a development we will see in the next few years. Artificial intelligence, as you mentioned, is not to be stopped in any area of medicine, and the same is true for Mohs surgery. This will revolutionize. But my main wish or vision for the future is really that Mohs surgery, as we know it, is allowed to become the standard of care for patients with epithelial tumors in Europe, as it is in other parts of the world. I think in parts of Europe, we are almost there. But if you look at the map of all of Europe, there are many countries where, for political reasons, for cost reasons, whatever, Mohs is not the standard yet. And I think if in these places also the realization comes that Mohs is the technique that offers the best cure rates, the smallest defects, and is also very cost effective in the end, helps to save costs, that in these countries, Mohs surgery can also become the standard of care. That would really be my wish for the future.
Well, you've done a fantastic job of pioneering that and being one of the pioneers within Europe to that, and also, leading an organization which is helping people to train to high standards and also collaborate. I think that's so important within medicine, isn't it, to kind of work together not only within your own country, but to work together with other countries, which you're demonstrating so well through the ESMS and through your position statement, which I do recommend that everyone goes and reads because there's so much good information there. So thank you so much, Severin, for your very informative discussion on Mohs surgery within Europe today and for training. I hope people find this helpful. I definitely have found it helpful. So thank you very much.
Thank you very much for this interesting conversation. Thank you.
Thank you.
We would like to give a special thank you to all our listeners. If you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise find us on any major podcast provider. We appreciate you joining us and look forward to presenting more interviews, research, and other topics of merit. Until the next episode, take care of your skin.